Swine health programs within the USDA that we're working with currently, we got pseudorabies, swine brucellosis, classical swine fever, swine health protection, trichina, and swine influenza. I'm going to give a really brief overview of what we're doing within the USDA, within a lot of these programs, and some changes that may be coming in the near-term future here. So for swine brucellosis, just a quick slide here. Swine brucellosis, we are currently all states free. So far this year in 2012, we have indemnified a few herds due to swine brucellosis. There again, we continually find swine brucellosis and pseudorabies both in our herds that allow exposure to feral swine. We've had some herds in Georgia. We've had some herds in Hawaii, animals in Texas. This is pretty common. We're commonly finding animals in these areas where there's feral swine that are positive, finding herds that are positive in those areas. And there again, these are the herds that we've indemnified in 2012. In 2012-11 pseudorabies numbers, switching on to pseudorabies now, just to give you some surveillance numbers. And this is due to our changes in surveillance activities, our surveillance streams that we've started implementing back due to the change of the pseudorabies surveillance plan in 2009. Our diagnostic submissions, we kind of started implementing it in 2010. That's working with our non-laboratories to get more samples in, to test our convenience samples, to test our high-risk herd populations. And if you notice, Harry, the computer's doing something again. If you notice, we've had a big increase, especially in our diagnostic lab submissions. We're getting the word out, showing how important this stream is for moving on in the future. Our sick pig submissions are moving up, where we're testing more now than we were last time. Our routine serology has doubled almost. High-risk swine population are doubling. We are testing more. We're getting the word out to be looking for these samples in the non-laboratories and what samples qualify for testing. So if you have a non-lab within your state that's testing for pseudorabies, please inform them to continually look for these surveillance to participate in the pseudorabies surveillance activities, because it is important for all of industry to know where we're testing, so we're not excluding a certain segment or a certain state. We need to make sure all the non-labs that are available to participate can participate in this program. For pseudorabies, since 2004, we've been free. We have, there again, indemnified herds. For these couple herds were duly infected. One was swine brucellosis 2, Hawaii and Georgia so far this fiscal year. Something of importance for both pseudorabies and swine brucellosis is we need the state's help in getting our data back. As samples get confirmed at the non-laboratories and NVSL, we need to follow that trace up back. So if we get a positive result from NVSL, we need to be able to follow that back, whatever happened to that positive sample. To get that report back, to be able to follow that sample through, allows us to justify the testing numbers that we get. So if NVSL tested 100 samples that were positive, we have information to show what happened to all those 100 samples and where those herds were. Otherwise, if somebody came in and did an audit, let's say an external country, and they say, well, at NVSL you tested 100 samples that were positive, where did all those 100 samples go? If we can't give that information back to those external auditors, it doesn't do good for our credibility if we don't know where those herds are. If we can give them information to what those samples were, whether they were transitional herds or high-risk herds, just retests of certain things. Having that follow-up helps. So I really would ask all the states that are here today to make sure we get that feedback from those states. There again, the PRV is a regulatory program, and I just would like to stress that all the samples that come into those labs should have an equal chance to be tested, whether it's through all of our different surveillance streams, whether it's through slaughter, whether it's through the non-laboratories. All those samples should be tested or have that opportunity to be tested. That way everybody's on the same equal playing field. We're not excluding a certain region or a part of the country. We are continuing to test feral swine for monitoring. We're just monitoring for pseudorabies status in feral swine, and we do find a lot of PRV in feral swine. And the goal of this is to protect the commercial industry and those animals in interstate transit. Just to give you a quick overview, and I know I'm going pretty quick because there again I'm already behind already. In this coming soon in the Federal Register, we are in the final stages. The finish line can be seen on publication of a comment on a proposed new framework for pseudorabies and brucellosis. It's a concept paper that mirrors the brucellosis and TB concept papers that were recently published 2 years ago now, where it modernizes the framework. It gives us flexibility. It's risk-based. It takes a lot of our program standards that we've had in the past now, puts it into allows us to move it into the CFR in a flexible framework, prescribes results versus actions, which means instead of saying you will do A, B, C, it gives us, say, our goal is to get you to do A, B, C, and how you do it is you just need to reach that goal. And then it introduces science and surveillance into, instead of just reaching out trying to get surveillance numbers, where we can use science to ensure that our animals in commerce are hopefully a low risk for disease. It changes the reporting mechanisms. I know a lot of states feel like it's just a routine to fill out that annual report every year that they've been doing for year after year after year after year since we've been free. So it changes some of those reporting requirements and the burdens there. It increases our options for managing our infected herds that we do find. Times are different now than they were a long time ago. We don't have all the indemnification monies that we had. We need to make sure that we increase our options to look at these infected herds to make sure they're contained so they don't affect or move in interstate transit in any way to affect any other part of the industry. We enhance our surveillance with these regulations. They allow for enhanced surveillance. They incorporate surveillance into the regulatory component versus our old regulations, which our current regulations was basically deal with movement of diseased animals. And it like the TB paper and the brucellosis paper, it moves away from the state classification systems because, as you just seen, all of our states are free, but yet we commonly find a lot of disease in those states, especially those with feral swine. There's other issues that we have to deal with. Indemnity. We have differences between pseudorabies and swine brucellosis in our current CFR. Why is a pig with pseudorabies any different than a pig with brucellosis on what its current value? We have to take into account that the disease has been eradicated in a commercial swine definition, but there's different regulations, different risk factors that are not being taken into account. We still have that disease exposure in our wild feral swine. We're always going to have that disease here in this country. Pseudorabies in the country is never going to be free. Swine brucellosis in the country is never going to be free because we're always going to have it in our wildlife reservoirs. We're always going to have it in those reservoirs, those high-risk animals that allow exposure to those other reservoirs. So we need to have a regulation that allows changes for that pertain to the movement of animals so we can ensure there's low risk. The animals in interstate transit are of low risk for disease, so we need to allow surveillance to be able to target those animals there. So the concept paper, we'll notice it'll combine pseudorabies and brucellosis into one, basically because they have a lot of the same risk factors, even though they're different diseases. This is back to the comprehensive surveillance portion. We're moving everything into one comprehensive program. It establishes interstate movement parameters, and it provides conditions for interstate movement for infected and exposed pigs, just like the current regulations do today. The concept paper allows for more transparency than we've had in the past. We want to make sure we're working with our states and our industry partners to provide those transparency so all states know what other states are doing. We're not trying to hide or make sure cover anything up. We want every state to know what's there and allow everybody to have that comment process. The concept paper will also address some of the laboratory concerns where we're trying to correlate and make sure that all laboratories are consistent between each other, yet we need to make sure that they are proficient in what we're doing and make sure we get a standard result. So the concept paper contains those details on those issues, and we need to remember that we've been free in these diseases for a long time, and we need to provide the best service we can to all of our stakeholders, so we need to look at a program that's going to do that, and we need to change the way we're doing business. And what I'm asking you is it not time to evolve into the next phase versus staying in the eradication phase like we've been in for many, many, many years now. And we need to look at changes in that regulatory environment to be able to evolve to the next step. So that paper will be coming out this summer, late spring this summer. Like I said, the final touches are in. We're just waiting for publication in the Federal Register right now, and when that will happen, I cannot honestly answer. After that paper gets published in the Federal Register, it'll be open for comments. The paper will be available for viewing then. It'll be open for comments from all stakeholders, and we also, as the USDA, we also plan to have multiple stakeholder meetings around the country like with the TB and brucellosis side, to discuss the regulatory changes, to discuss concerns that stakeholders may have, and those will all be open to the public, so we can have open dialogue back and forth on the regulation as we propose to start drafting those regulatory concepts. To keep moving, since I'm behind, classical swine fever, we have our different surveillance streams. We have our 5 different streams that we've been testing. These are the same streams we've been testing for many years now. Our swine high-specific CSF, our slaughter swine, our swine submitted diagnostic laboratories, feral swine, and high-risk feeding operations. We have our surveillance numbers. The thing to realize with our CSF surveillance is all CSF samples that we've received to date have been negative for CSF. And Swine Health Protection Act information, we are continuing to do inspections for swine health protection. Most of our swine health protection are garbage feeding operations, which is swine health protection. Most of our garbage feeding operations are in the Commonwealth of Puerto Rico, where that's where most of our inspections actually occur. Most of our licensed premises are. About half of them are actually in Puerto Rico. So we still do a lot of inspections of premises, temperature checks, violations. We also do a lot of our states we have cooperative agreements with, where they go out and look for premises that are non-licensed premises that are feeding garbage operations. USDA did 33,000 inspections last year and found 75 non-licensed feeders. In those states where we allow garbage feeding, this map tells us the states where we allow garbage feeding, and states where garbage feeding is not allowed, and those states that it's not allowed to be a state regulation that would prohibit those garbage feedings. Swine health influenza, there again I'm just giving a brief overview of the influenza program. I think Jennifer is going to give a deep talk on influenza. So we have our different surveillance streams, but just things to stress from the USDA standpoint is swine are susceptible to influenzas from birds, humans, multiple species. We're just like we're susceptible to influenza. Influenza viruses are constantly changing. And viruses constantly swap genes back and forth. We're having increasing genetic diversity, which helps complicate diagnosis of swine influenza in many cases, and that humans do not normally get infected with swine-type viruses. And there I said not normally. But sporadic infections are found and are occasionally discovered. So we have our objectives of our swine influenza surveillance program. It's to monitor genetic evolution, provide isolates for research, and provide a progressive development of diagnostic reagents, assays, and vaccine products. We have our different surveillance streams to help where we get the information for those objectives. Those includes our case compatible submissions to diagnostic laboratories, our fairs, our markets, our first point of commingling of animals, and our swine-linked influenza cases where humans have been found with influenza, and we do a back investigation. This is the data that we've had so far up through January of this year, and notice the red line, how it shoots up there in October of 2010. That's when we moved over to anonymous surveillance. It's just kind of a brief overview of how the anonymous surveillance allowed us to really get the program up and going. And there, as you notice, there is some seasonality there, of course, too, with swine surveillance samples. USDA, we are subtyping, and this is through January of this year, and you notice most of the swine subtypes we are finding are typical swine flu influenzas. We're finding a lot of H3N2s, H1N2s, and H1N1s. But we do have 2% of those samples that are other mixed and different types of swine viruses that are all of interest to what's occurring out in the field. You never know what will be the next major swine influenza virus. We are sequencing, and this is through December 31st of last year, of course. NVSL and working with NSU and folks, they are sequencing and recording that data appropriately. And there again, we are working forward and getting the sequence data out, and that gives you just a brief overview of the samples that we've sequenced through January of this year. And in conclusion, I'd like to say our surveillance is changing. We're continuing to go focus on stream-based versus disease-based. That we will have the concept paper out. That'll be out for comment here shortly. We're continuing to work on SIV with stakeholders. And surveillance will continue to evolve and become more comprehensive.